most common fracture that the kids get when they fall is usually the upper arm fracture, the upper limb fracture. And the commonest is the supracondylar fracture, which is the elbow fracture. The first thing that the parents have to notice is whether the injury that the kid has sustained is indeed a fracture. Sometimes there's a deformity. That's a more severe fracture with displacement of the bone, for example. Or it may just be a simple swelling, or there may be some redness, and the kid will not move that injured area. It's best to immobilize it. The kid is wearing a shirt, you need to remove the shirt. Just be extremely careful. The next step is to try to get an assessment. So you can either bring the kid to the nearest general practitioner, or to the specialist, or to the accident emergency department to get an x-ray done. Ice packs or some elevation would solve the problem. But if there is a fracture of the bone, then that would require some sort of treatment. The treatment can either be surgical treatment or non-surgical treatment. Again, that depends on the nature of the fracture and the location of the fracture. In a child with a normal bone fracture, where the bone structure is normal, usually the fracture heals within 3 to 4 weeks. But if there is some problems with the bone healing, or there's a delay in the bone healing, it can take up to 6 to 8 weeks. If it's an upper limb fracture, like a wrist fracture or like an elbow fracture, you can still allow the child to go to school, but with a cast or with some sort of protection. If it's a lower limb fracture, then it becomes a little bit more complicated because the kid cannot put weight and walk on that leg. Then some crutches may be necessary, or maybe even a temporary rest at home may be necessary. So we usually prep the parents in terms of the recovery phase, because a lot of times parents need to take time off to look after the children. They have to make some logistical arrangements. If surgery is required and surgery has been done, then it becomes one more step where the wound has to be taken care of as well. You have wound care as well as cast care in kids who have had surgery. So pin care basically is to make sure that there's no dirt accumulating, there's regular dressing that is done, and you have to make sure the pins don't migrate out, they don't shift out of position. We also tell the parents to avoid certain activities. Kids tend to forget because they don't have the pain. All they have is a cast. They tend to move around, they tend to use that limb or that leg, and that's when the problems may come in, because a fracture can tend to displace. Kids have a tremendous potential to heal themselves. Okay, it's just the position in which they remodel. We want to avoid angulation, we want to avoid rotation, we want to avoid displacement. The kids will always remodel. They have a very good potential to heal. So they don't actually need additional tonics or health supplements. For the lower limb fractures, it's actually quite simple. Sometimes you just wear shorts, and you can have very loose or baggy shorts. We also have cast protectors for the lower limb. The tricky part is with the lower limb fracture, it's the mobility. Children who need some help with crutches, they need to be transported around in a car.